Why do we give oxytocin in labor and delivery? Oxytocin is actually a hormone that your body naturally produces, and it is the hormone that actually causes the uterine contractions if you are to go into labor on your own. So the oxytocin that we give to you in a hospital setting is a synthetic form, and we give it to you through an IV. If you are given oxytocin in the hospital, it is usually given to you for 3 different reasons. The first being to induce labor, the second being to augment labor, so labor that you already have going, but you need more contractions. And then thirdly, it's given in the postpartum period to help with postpartum bleeding. So if we are starting oxytocin on you while you're in labor, we start it at a very small dose of only 2 milliunits, and it can go all the way up to 20, even 30 units sometimes. So we increase it by 2 units every 30 minutes. Side effects that can happen from oxytocin is something that we call uterine tachysystole, and this basically just means that you're having too many uterine contractions. This can also happen on your own if your body was to go into labor completely on its own and we aren't using synthetic oxytocin, again because your body produces it on its own. So the reason why this can be dangerous is because babies are only made to withstand a certain amount of contractions. So they're made to have a contraction for about 60 seconds where it's kind of like they're holding their breath during the contraction, and then they're releasing and getting about a 60-second break, and then another contraction comes and they're holding their breath and then they get another break. So if they're not getting enough of a break, they can become distressed. And the good news is in the hospital, we have medication here to counteract the effects of the oxytocin. And this is also why we're always keeping a really close eye on your contractions, and we're not giving you too much of the oxytocin all at once. Another good thing to note is that oxytocin washes through your system really, really quickly. So if it's given to you through an IV, we can stop the medication really quickly and it'll be out of your system within a minute or 2. Oxytocin is also usually given in the postpartum period in order to help with postpartum bleeding and help prevent any bleeding. This is just because your uterus contracts down, and this helps to clamp off any of the bleeding that you're having. It's a lot less risky postpartum because you don't have the baby inside you anymore. So we tend to give it to all of our patients routinely in order to prevent any postpartum hemorrhage that can happen. If you have any other questions about oxytocin, make sure to talk to your own care provider and team because they will always answer all of your questions, and make sure that you and your baby are in the safest, best possible care.